Hello, good afternoon. My name is Erica Tapia. I'm going to be your nurse for today. First thing I will be doing is doing my hand hygiene. Can I please have your name and date of birth?
Andres Coleman, July 11, 1989.
Okay, great. Thank you for dedicating the time and consenting for another assessment. I will be gathering all the tools, necessaries, and supplies to perform this assessment. I will start donning my non-sterile gloves, and let's start with taking your temperature. We can do frontal temperature, and we can do also the sublingual temperature or axillary temperature as well. The patient is already sitting in a comfortable position to doing this assessments. We will be using the appropriate thermometer and making sure there's no signs of fever or any indication of numbers of fever as well. If there's any abnormalities, we will be telling the MD for further instructions and orders. Next, we will be doing, again, the patient is in the supine position, better off, and this is to make sure we do the strong, the pulse for strength and the rhythm and count. So we will count respirations. Normal respirations for the most part are 12 to 20. And a normal heart rhythm is 60 to 100. And we will be using a stethoscope to assess the apical pulse for further assessing these pulses. So let's start with that. The heart rhythm for the apical pulse is going to be on his left side of the chest and underneath his lower left chest. I hear it. It sounds normal. Then to assess the respirations, again, the rate is 12 to 20. And we can use a watch or the actual chronometer, whatever you have handy. And you will be taking it for a minute. Okay, so normal respiration rate is a 15. And also we will be using the oximeter and making sure it correlates with the patient's radial pulse. The radial pulse is going to be located right by his thumb. So you get his thumb and you get the radial pulse right in here. You want to make sure that correlates with the oximeter as well. Next, we will be doing an assessing for blood pressure. So you will be selecting the appropriate limb and cuff size for the patient. So you have normal or you have plus sizes as well. Next, we will be doing we will be measuring the patient's scale for pain. So in this case, the patient is alert and oriented times 4. So we will be using the pain scale from a 1 to 10, 10 being the worst. We will be also checking for pain or assessing for pain just to identify any underlying cause of pain and evaluating how the person can go into his day-to-day functioning, and we will figure it out, the pain management strategies as well, with the help of the MD. So from a 1 to 10, can you tell me how bad is the pain at this time? 10 being the worst.
6.
Okay. So 6 meaning that he has. Where is your pain located?
Here.
Okay. So being that it's a 6, pain of 6 to out of 10, we will be measuring for any symptoms. We will have to assess as well any type of allergies or any activities he previously had today. If he has any past medical history, when did it start, and if it's gradually, if it's suddenly that happened. We will be checking any other area where it can spread, or if it's radiating at this time. What kind of pain is it at this time? Is it throbbing? Is it dull? Is it stabbing? First things first, we want to make sure if you have any other medical history.
No.
No. Okay. Do you take any medicines?
No.
No. Okay. Perfect. So, assessing the patient's vital signs are not only the route you will take. You'll also do like a whole head to toe assessment in the muscles, in the skin, the abdomen, making sure there's no any other abnormality and any weakness, any sudden changes that the patient has had. Patient looks, as far as the behaviors of pain, he can be having facial expressions like frowning, and he can have also physiological changes. At this time, he appears to be normal and calm, even though he's on a pain of 6 out of 10. But at this time, we can conclude and go ahead and ask the MD for further orders. So I thank you again for this assessment and you consenting for it. Have a good day. Thank you.